was just having some real difficulties. I had been to a dentist at the beginning of the year just for my yearly exam and the x-rays and all of that. But at that point when I went to the dentist, it was just for routine, the yearly exam. I was not having any issues. And when they looked at the x-rays and examined my mouth, they just determined that I had some really old fillings, big fillings that they thought probably needed to be replaced. And there was a crown that they wanted to replace. So I went ahead and had them start working on the crown. And when they went ahead and took the crown off and were prepping the tooth, they noticed that it was cracked, and they weren't sure how badly it was cracked. They were going to go ahead and do the root canal, and then when they were in there, they would determine if the crack was severe enough that the tooth may need to be extracted. So they started the root canal, and when she was in there, she did decide that the tooth would not be able to be saved. So they stopped what they were doing and then set up everything for the extraction. I had the tooth extracted. They did the bone graft. And then when I was there for that, they mentioned that my two bottom teeth would probably also need crowns on the same side. And so I went ahead and set up the appointments for that. Went in, they were going to do both of them the same day. When they were in there, they got them prepped, but it was a very long, it took forever for them to do it. So my mouth had been held open for a very long time. There was a lot of work on the teeth, and it felt like a lot of pressure being put on the extraction site too. So once the Novocaine wore off, my whole mouth started throbbing. Went back in on Friday and did not see the same dentist who did the root canal work. And the dentist that I did see, not root canal, the crown work. But anyway, the dentist that I did see thought that I might have a dry socket where the extraction site was. So I went almost another week, and it did not improve, didn't change. So I went back in and was told that it was not a dry socket, that probably what was going on was I did need root canals and possibly another extraction on the tooth next to the one